Shoulder joint replacement is possible. Yes, if your shoulder is damaged and it is beyond repair, then we do have new technology in which we replace the damaged shoulder joint with metal and plastic and give you back your shoulder function. And most of these patients do not have pain. Namaste, my name is Dr. Prashant Meshram. I work as a shoulder specialist at Apollo Hospital, Jubilee Hills in Hyderabad, India. We have a lot of old patients, especially above 50s or 60s, who have severe shoulder pain for a very long time. For many years, they are suffering with pain which happens during activities. It is not letting them sleep in the night. It is not allowing them to get up from the bed. It is not allowing them to comb their hair or go to the washroom and clean themselves. We live in a world in which all of us want to be independent. Despite of the age, I have patients who are 80 years old, 90 years old, who are living alone because their family or their daughters and sons are living somewhere else. And this is a common scenario these days. So you would want your parents, your grandparents to be independent as much as possible. This requires a functioning shoulder. This also requires to live pain-free. It is not just about that. It is also about the dignity of people. You want to remain independent, especially in the old age. You don't want to depend on someone to make your hair and wear your clothes or just go to washroom and wash yourself. That's why this video is important if someone in your family is suffering from shoulder pain for a long time. So there are multiple reasons why shoulder joint can get damaged. It can be because of arthritis, which is just age-related wear and tear of the joint. It can also be because of cuts in the tendons or muscles in the shoulder which have not been treated or they have been damaged severely and it is beyond repair. It can also happen because of someone who had a history of recurrent dislocation or someone who was a heavy worker and laborer and has done overuse of the joint and now it is having advanced arthritis. Someone who is also fallen down and broken the fracture, especially old people, which is beyond repair, or it is just shattered into pieces and we cannot put it together. These are all of the patients which are candidates for shoulder replacement. There are multiple types of shoulder replacements which are possible. One is by replacing the ball of the shoulder with the ball and replacing socket with the socket, or we can reverse it. What it typically means is the position of the ball is at the socket and the position of the socket is at the ball. The reverse shoulder replacement, which I'm talking about, is an advanced surgery which has become extremely popular in the last 20 years. So reverse shoulder replacement does not require muscles to be intact. It can be done even in patients with a lot of bone loss in the shoulder. So please do consult a shoulder specialist to understand if you can be benefited with a shoulder replacement. Thank you.